Hey guys, this is Dr. Hub. Today we'll look at the causes of the oligohydramnios and the polyhydramnios. So first we are looking at the oligohydramnios. So in terms of the maternal causes, what are the maternal causes? The maternal causes is when there is an undiagnosed rupture of membrane. So undiagnosed rupture of membrane, and this is the most common. Next there is a spontaneous rupture of membrane. Spontaneous rupture of membrane. Then comes the post-dated pregnancy. The post-dated pregnancy, and there is also the preeclampsia. Next is the presence of NSAIDs, NSAIDs, as well as the ACE inhibitors. ACE inhibitors. Then let's move on to the fetal causes. The fetal causes, it can include the fetal anomalies and the renal agenesis. Then comes the urethral defects. So there is the urethral defects. That is, there can be the posterior valve or the obstructive uropathy. So there is the posterior valve, this posterior valve, as well as the obstructive uropathy. Next, what we look at is the placental. So in terms of placental, what do we have? So placental is nothing but a failure of the secretion. So placental is nothing but the failure of the secretion. So failure of secretion, so what is the example? Example is the amnion nodosum. So this was about oligohydramnios. Now we look at the polyhydramnios. So in terms of polyhydramnios, what are the maternal causes? The maternal causes, there is overt diabetes, and there is also the gestational diabetes. There is cardiac diseases, as well as renal diseases, and there is liver failure. In terms of the fetal, what are the conditions? In terms of polyhydramnios, there is multiple gestation. There is NTDs, neural tube defects. There is abdominal wall defects. There is also the cleft palate, and there is the neck masses, esophageal atresia. There is also the aneuploidy. There is hydrops fetalis as well as the triple TS. Next is we look at the placenta. So in terms of placental, what is the polyhydramnios? Cause it is the chorangioma of the placenta. It is chorangioma, and this is nothing but of the placenta.